Let's talk about things that cause an increase in inflammation and things that cause a decrease in mobility, which would then lead someone to come see you.
Dehydration, stress, injury, or just struggles moving. Also, I guess fact that I'm good at it.
Oh, sure.
We're recording.
How are we doing this? Let's see. Let me think.
Boom!
Andrew Deering is a licensed massage therapist in our area. Taught us a little bit today about overcoming injuries, using massage to not only relax and feel better, but to actually increase mobility, reduce inflammation. Those are kind of my two big takeaways, from our conversation. What'd you think?
Dude, I liked it. I felt more educated now because we've had Dr. Frank on, we've had Dr. Brackney on, we've had Stretch Labs on, we've had Christina and Dr. Garcia on. It's just
That's the same person.
Oh, damn.
Don't
Christina
worry. I won't tell Cameron that you forgot her name, dude.
Christina and Dr. Cameron.
I'm going to send her this, dude.
You could have probably seen me just trying to process. I was like, shit.
She's going to eat you alive, dude.
Dr. Cameron and Dr. Christina on.
Yeah.
And we've had just so many professionals in the field. So it felt like, having him on just was like an infinity gauntlet, like a little jewel added to the infinity gauntlet of recovery now. So, it was really cool to talk to him and just get that deeper understanding of fascial release and just general recovery. So it was cool.
Yeah, for sure. So guys, if you're considering doing any type of massage and maybe you're looking for someone to help you out, definitely check out Andrew. Listen to this full episode, learn a little bit more about him, how he works. And hope you enjoy. Make sure you like, subscribe for more information and listen in here.
We have been starting the episode for a while, Andrew, I ask the guest what they had for breakfast. So what'd you have for breakfast this morning?
This morning, I had an omelet. I took 2 eggs and a cup of egg whites, scrambled the eggs real quick, poured the egg whites in, scrambled it again, poured it in the pan, butter in the pan, make sure it doesn't stick. Wait for it to, start to cook a little bit, flip it over, expand the omelet, flip it over, make it real good,
Dang.
And just a little bit of ketchup on top.
I love ketchup on eggs, dude.
I usually didn't.
Methodical. Very methodical.
I had been doing Tony Chachere's.
Ooh, what about Cholula?
I haven't tried Cholula.
Dude.
What is Cholula?
It's a hot sauce. It's the only hot sauce that matters, actually.
Okay.
Yeah, no other hot sauce really matters enough to even mention it. So, anything with that? Just eggs by itself with some ketchup, or
eggs.
no
ketchup.
toast, English muffin.
Nope, water.
Dang.
And then I take my pills for the morning.
He's a low carb guy.
I hear him. What about you, Phil?
I like carbs, but
I had steak and potatoes.
Steak and potatoes.
breakfast.
For breakfast.
That's a dinner for breakfast.
I was in a little bit of a rush this morning, so they just popped it in the microwave and actually ate it on the way in. I don't love doing that. I'm not a fan of eating on the go. I try to really recommend people not to do that because they know the satiety effect and things like that aren't as good. But it's the situation I was in.
That's what you got to do sometimes.
What about you, Sean?
Man, that's a way to be in a rush, man. It's like, oh man, I'm in a rush. I got just this filet mignon and this duck
Top
egg
sirloin.
or something.
Top sirloin. Yeah, Denver killed it on the top sirloin this week. It was so good. That's my wife. She's amazing.
Nice.
Awesome.
I love that in. So I had something similar actually. I had steak and eggs for breakfast.
Dang.
Yeah,
Nice.
steak, scrambled eggs, nice and seasoned eggs, and like to keep it real simple. So
Ooh, love that.
Yes, sir. Yes, sir.
All right. Well, Andrew, we learned what you had for breakfast. Tell us a little bit about yourself. You're a massage therapist, right?
Correct.
I got your information from Dr. Adam Weiss.
Right.
I was over there the other day, saw your card, and I was like, this looks interesting. Checked out your Instagram. Super into all things fitness, but especially massage. So tell us a little bit about kind of maybe what first got you interested in massage, how that whole process started, and what you do.
So initially, my story for getting into massage therapy isn't very great. It's not great. So I graduated from high school, and for a couple years, I kind of had my head up my butt.
Okay, didn't we all?
Yeah. I stayed at home, played video games all day.
Okay.
Wasn't good, and because of that, I continued that habit even once I started going to school and started working, and that's how I ended up hurting my back. But my dad encouraged me to start developing a skill. Massage therapy is always something I kind of did for him growing up.
Okay.
He'd get knots in his back or whatever. He works real hard. He was always a restaurant manager.
Okay.
So he'd been in that industry for about 14 years.
That's what my wife did that before. She
Oh, really?
recently stopped doing that to help us here at the gym. She's a personal trainer now.
Awesome.
But tough job, dude.
It is.
Very difficult, very demanding, lots of hours, and way more physical than people realize.
It is. And it would, and this goes on to more what we've been doing more recently for him, but he quit his job back in December of 23.
Okay.
And basically, the job left no time for him to take care of himself. And so he ended up getting very bloated in the stomach area, very skinny limbs. So we're trying to rebuild his muscle mass, get his activity levels back up.
Okay.
He's getting ready to start looking for a new job. You know how it goes.
Mm-hmm. So he really pushed you. Like, I'm not going to say pushed you, but he's the one who maybe motivated or got you interested.
So he basically dragged me to the massage school.
Okay. And you were how old at this point?
Gosh, I had to be 20.
Okay.
Yeah.
And before that, lots of video games. Were you
Yeah.
working out at that time? Or?
Not at all.
No?
Not
How'd
at
you
all.
hurt your back? Where did that come in?
So I hurt my back in October of 21.
Okay.
Okay. And I'd been working for Massage Envy for a couple years.
Okay.
Or no, for probably about a year at that point.
Mhm.
And so I was working on a client. Gentleman he said he used to play in the NFL or whatever. Nothing crazy. But I was working on his forearm, and I'd been making efforts to try to change how I work a little bit, So I was trying to fix my posture
Okay.
because I'd always hunch over.
Mhm.
Well, you know how that happens. You start making a change, and then you do it wrong.
Right.
And so I twisted my back, tried to tighten down too much, twisted my back, let my body move the way it wanted to. That was a mistake because I was just pulling too hard.
Okay. And so before this injury, you were more into like relaxation style massage. Is that accurate?
no,
Is this
I'd
kind of
always
what moved you in the
been-
direction of injury stuff?
No, I'd always been more on the therapeutic side, on like some of the muscular recovery and all that.
Mhm.
But when I went to the Texas School of Massage, which is right down the street on El Camino in Gemini, right? They teach Swedish. And even during internship, I was always more focused on, working out the tension of the muscle a little more, giving them that therapeutic effect.
Can you define Swedish for us?
So Swedish massage is light, long, relaxing strokes. It's relaxation. It's not so much into the therapeutic effect of the muscle and all that. It's what they call foo-foo.
Okay. And what got you interested in making the pivot a little bit to more of the therapeutic stuff?
Well, I'd always been more interested in that.
Okay.
I always found that type of the work more satisfying.
Because you feel like you're like fixing an actual problem. Is that accurate?
Kind of,
Okay.
yeah. So obviously, you can't fix it.
Uh-huh.
That's what the body is supposed to do. It's supposed to heal it.
Okay.
What you do as a massage therapist, and there's another term that we use called manual therapy. All you're doing is creating the opportunity for a change in the tissue. Does that make sense? You're facilitating a change.
I like that. So you're trying to get the body to do what you want it to do versus what it wants to do on its own in its current state.
Correct.
Or give it the ability
Exactly.
to make that change.
Exactly.
Okay.
And so you can't force the body to do anything because all that's going to do is create more trauma, more injury, and more pain.
Sure. Yeah. And where did you get your experience for this type of massage? Is this something that you started kind of doing on your own? Did you go to a different school? Because you said at the Texas School of Massage, it was more just this.
Well, that's what they
Swedish style.
focused on.
Uh-huh.
But like I said, I'd always done more of that growing up for my dad,
Right.
So going to the school, getting licensed, that was developing the skill.
Gotcha.
Now, I can still do that relaxation stuff, but I prefer not to.
Okay.
That's just a preference deal.
And what would you call what you do? If Swedish is
Therapeutic.
okay, and that you said a Swedish massage is long strokes.
Mm-hmm.
So tell us about therapeutic massage and how that works and what the difference is.
So therapeutic massage is basically, the goal is to help, right?
Mhm.
It's to help try to either reduce inflammation, try to reduce pain, deal with an injury, that type of stuff, right?
Mhm.
You can increase mobility. There's a lot of things you can do and a lot of different techniques you can use. But the problem that you run into is that a lot of people don't know how to relax,
Sure. Okay.
especially when they've spent a long time neglecting themselves and they've just constantly beat their body to nothing
Mm-hmm.
because they work so hard. And then they're already high-strung mentally. So you still have to inspire that relaxation effect too, because there's the idea of trust and all that too.
What do you mean by that?
So a lot of therapists, when they work on people, they'll do deep tissue. Are you familiar with deep tissue at all?
I think I am. If you could define it for us, though, would be great.
So deep tissue is basically very deep, hard pressure. The idea is to help break up the tissue that is tight.
Okay.
A lot of therapists will end up doing more damage than good if they continually do deep tissue like that.
How can you tell?
So pain levels, basically. It's subjective.
Okay.
Everything's subjective when you're just doing hands-on, right?
Sure. Yeah. I mean, it's a lot of communication between the therapist and the
Exactly.
client, right? Yeah.
Right, because everybody's pain resistance and pain levels are different too.
So when you're getting a massage, like should it be a little uncomfortable if you have an injury and you're in a massage situation?
It should be a little uncomfortable.
Scale of 1 to 10, 10 being the worst. Where should it be?
Ideally, if you want it to be 5 or 6.
Okay.
7 is acceptable sometimes if the injury is particularly bad,
Okay.
because you still have to create that ability for it to change.
Mhm.
Ideally, you want it to be between 5 and 6. That's where I aim for,
Okay.
because you want it to be on the edge of pain, but not so painful it's you can't handle it.
Right.
What I call it is it feels good. It hurts.
Yeah, like the good hurt.
The good hurt. Exactly.
Okay.
Because you'll feel the difference. You'll feel the pain, but it's not overwhelming pain, but you also feel the relief at the same time. And that's the pain that I aim for.
Gotcha. So if you're getting a massage, if you have some type of injury, whether it's a gym injury, a work injury, anything, and you're seeking massage and you're getting this massage and your pain levels from a scale of 1 to 10 are 7 or above, you're saying that therapist could be doing a disservice to the person.
Correct. And that's something I've had to learn in the past as well, because I was guilty of it too.
Okay.
I would do the deep tissue and I thought, oh, this is much harder. I got to go harder.
What do you mean by this
wrong.
is much harder?
So, for example, glutes.
Okay.
Glutes can get very, very tense. They're very large. They're the largest muscle in the body, pretty much. Muscle group, I should say, and they're overlapping multiple layers too. Then you have the hips under them, the sacrum. It's a lot of fun.
Okay. Yeah.
I say that sarcastically. I say it's a lot of fun, but when it's really not.
And no, I mean, if you're any type of injury that involves the glutes is not going to be fun because it's such a critical muscle. And it's
really
like
is.
you said, it's so big and so deep.
Layered.
And layered is a better word than deep, actually. That the outcome of that injury is not going to be very fun.
Right. And it's difficult to just get straight to it.
Okay.
Because you have to spend your time going through the tissue. And the mistake I made in the past too was I tried to force my way through. You can't force your way through. You have to give it time.
So you need to go softer but take longer.
Yes.
Versus just dig in there.
Correct. And over time, as you hold some soft pressure, doesn't have to be super soft. It can be firm enough. But the idea is to allow the tissue to relax, change the nervous system response to that pressure, essentially. That's another way massage works. It affects the nervous system.
Yeah. Do you have any, tricks to getting your clients to get into that relaxed state?
There's a couple. So one of the things I'll have them do a lot of the time is take deep breaths, just in through the nose slowly, out through the mouth like a straw. And then when we do that, it helps them to relax more.
Right.
Another thing I'll do is there's another technique you can do. It's almost like tricking the muscles into relaxing more than they're used to, right? So when you find a spot sometimes where they can't relax and you want to go deeper, you'll put pressure into the muscle, have them activate that muscle. So you're going through movement. You'll have them push against you and then relax. It's like a deeper stretch thing. That's a stretch trick.
Yeah, it's like an assisted stretch.
Correct.
Yeah, I've heard of this. We talked to, I think her name is Katie from Stretch Lab, and we talked a little bit about that, I believe.
Right, and that's just
interesting.
just a little nervous system trick
But then once that's done, though, it allows you,
to work a little better.
yeah, like your techniques will now work better because
Right.
the person and the muscle that you're working are more in a relaxed state.
Correct.
Yeah.
And so it basically tricks that nervous system into not holding as much tension in the muscle.
Okay. I have lots of questions, but I'd like to focus maybe on two things that you mentioned.
Go ahead.
One was the reduction of inflammation.
Correct.
And then the other one would be the increase of mobility.
Mhm.
I'm sure that, and you're welcome to speak too on the various reasons someone would come to see you.
Right.
But those are the two that I'm interested in.
Right.
Reduction of inflammation
Right.
and increase of mobility. Those two things personally spark my interest. So I'd like to kind of maybe hone in on those two things. So when it comes to reduction of inflammation, like what's going on before and after and during a massage when we're talking about inflammation?
So of course, first let's identify what inflammation is, right?
Sure.
It's the body's healing response to an injury of the tissue, right?
Mhm.
So your body is increasing the heat, it's flooding that area with blood, and it's trying to heal the tissue, right? So massage-wise, a lot of the technique I use is trigger point. Now,
Okay.
trigger point is where you hold a specific spot, usually swollen, maybe inflamed, and that pressure ends up pushing the blood out of that tissue, right?
Okay, so your goal with the hold is to push the blood out of that
That's
area.
not the goal
Oh,
necessarily,
okay.
but there's also a fascial component. Are you familiar with the fascia?
Yes, but if you could define for us.
So you know the fascia is that tissue that sits between the muscle and the skin. It connects to everything, wraps around everything. Your meninges, for example, around your brain is all fascia. Your spinal cord, around the spinal cord, what's that called again? The tissue that surrounds your spinal cord.
Okay, yeah.
I forgot
I
the
used to be
name.
way better with anatomy
okay.
stuff, but
Spinal cord tissue.
We'll do a maybe Sean will do a quick little Google
Myelin
search.
sheath, the myelin sheath.
Ah,
That's what it is.
okay, that does sound familiar, but I never would have got that.
That's okay.
Yeah.
Took me a second.
Yeah, I know where the bicep is. You know what I'm
Right.
saying? Like the things that matter.
The myelin sheath is made of fascia.
Okay, gotcha.
Okay.
I heard someone describe, tell me if you agree with this. One time someone described fascia to me as a spider web.
Yes.
That is surrounding your entire muscular system. So even
So
if you
you've
mess
probably
it up in
talked
one
to
spot-
somebody about John F. Barnes' myofascial release then.
Is that what Frank does?
I think so.
I think so too. Yeah.
Then yeah, exactly.
Okay. Yeah.
So it wraps around everything. But it also sits between your muscles too, different muscle groups.
Okay.
And that's why your muscles can glide against each other.
So it creates less friction.
Doesn't create less friction, it allows for the movement. So it changes state with electrical impulse.
Interesting.
It's a very interesting tissue.
Okay. So when you're doing the trigger point, though, you're trying to manipulate that.
Not
in
just
a
the
way.
fascia, but the tissue of the muscle as well.
Okay.
There's a lot of different levels of it,
Sure. Okay.
if that makes sense.
Yeah.
Like if you go into it as deep as I do, it's like as far as the research, it's complicated as heck.
Yeah, I'm sure it is. But hopefully today you can simplify it for us mortals.
I hope so.
To understand. you
But
know?
basically, put it simply, you're trying to allow that tissue to expand again.
Okay.
Does that make sense?
Yeah. So when there's when there's inflammation going on in there,
And so the fascia will be tightened up a little bit.
yeah.
The muscle will be tightened up a little bit. And when you do that, it changes the state of that
you're just
tissue.
trying to go take it from a balled up fist
Yeah,
and loosen that grip a little bit.
exactly.
Gotcha.
You're not going to fix it all the way
Sure.
necessarily, but that's also why you do movement too. That's why we exercise. Because then along with that inflammation, there's also the lymphatic system.
Okay.
And the lymphatic system is, of course, your trash disposal system, right? Especially when you get infections or anything, the ones right under your chin swell up, right?
Your lymph nodes, right?
Exactly,
Yeah,
the
yeah,
lymph
yeah.
nodes. And so your body processes the trash out of the system, sends it to the lymph nodes, lymph ducts to different lymph nodes out through the body, to the kidneys, liver, whatever else, filters out, you get rid of it.
Okay. And inflammation is holding that quote unquote trash in a particular area. Is that
Not quite that, but,
Okay.
but I'm saying that the fascia also works with the lymph system, if I'm not mistaken.
okay? Gotcha.
That's what I've heard.
Okay, and so with the trigger point, we are
Allowing
work-
for that fluid to move more.
Yes. Okay.
Essentially.
Cool. And then what starts happening? I guess once you do the trigger point situation, we have inflammation in there. You talked about what inflammation is.
Right.
Now, we're in that trigger point. We're trying to move it out of the way.
Well, not move it out of the way, but we're allowing for the tissue to flow again.
Okay. Gotcha.
So basically, we allow that new blood to flow in.
Mm-hmm.
We allow that new lymph to flow in through the fascia,
Okay.
and then everything starts moving again.
And then that is what creates healing. Is that
Not creates
Accurate?
healing, but it helps to speed up the healing process.
okay? Gotcha.
Does that make sense?
Yes. And then you said movement. So
Mhm.
this would be after the massage. Do you like give some homework
Right.
as far as movement? Is there particular exercises that you like? Or?
Nothing crazy, no.
Mhm.
Just depends on the area what we're working on.
Okay.
Because the idea is the lymphatic system pumps from the muscular system. So it's based off of movement.
Mhm.
So, for example, when people get sedentary, that's why a lot of the times they'll be so sensitive or so tight because they don't have that movement of the lymph through the fascia and the lymph ducts.
Mm.
So then when they finally start moving, they get so sore, right? Because their body has been holding on to all of that extra junk.
Right. And and to me, if I'm understanding this correctly, this is almost the same process that is eliminating inflammation is allowing more mobility at the same
Correct.
time.
Correct.
Pretty much the same process is increasing it's decreasing inflammation while increasing mobility
Right.
at the same time. So we're getting kind of like a 2-for-1 type of effect here.
That's how I feel about it.
Yeah. And so what type of, let's talk about like what type of things bring people in to see you. Because obviously I mentioned that a reduction in inflammation and an increase in mobility are what kind of sparks my interest. But
Right.
let's talk about things that cause an increase
Mhm.
in inflammation and
Right.
things that cause a decrease in mobility, which would then lead someone to come see you.
Right. So things that'll cause that, right? Dehydration, stress, injury, or just struggles moving, you know? So one of the things I had done recently, I had cupping done. And I'd been having issues with my left shoulder for, probably 2 years since I injured my back.
Mhm.
I don't feel like I could move my left scapula the way I wanted to.
Okay.
Right? It still doesn't move perfect, but I noticed, especially after that cupping, I felt like I had more of a connection to it. And so I think that part of it is also that mind muscle connection too. And so a lot of times when I work on people, my expertise is part of it. You know, I'm really good at finding the trigger points.
Okay.
Does that make sense?
Yes.
So I find that spot that feels really hard, really tight. I hold it, move it around. I use a lot of different techniques, but basically the idea is the expertise is why they come to me.
Mm-hmm.
And also, I guess, the fact that I'm good at it.
Oh, sure. Yeah, if you don't mind, maybe expand on a couple of those techniques. Just like I'm curious myself. You
So-
talked about the trigger point thing.
Right, trigger
but
point's
what
simple.
else? Yeah.
Sometimes I'll use a little bit of lotion, a little bit of oil. We'll do some scraping.
Mm.
I don't like to do too much because a lot of times that can just end up being really painful, causing a lot of damage. If you do it too aggressively, same thing.
Yeah. What exactly? I've heard of this.
So scraping, basically they're metal tools.
Okay.
You'll find an area that's like really restricted. It basically scrapes the fascia, the skin, muscle, whatever else, increases that blood flow, causes some localized inflammation. But that inflammation, like we discussed, also brings extra blood flow to the area, right? So, and we know especially after your workout or whatever, you're going to have more blood flow everywhere,
Sure.
which is why, you get that blood flow, floods the area with nutrients, allows it to heal better, right?
Mm-hmm.
That's the idea behind that.
Okay.
And so you'll see those red splotches sometimes when you start doing the scraping. I learned what it was called recently from a friend of mine. It's called tiki eye.
Okay. And that is the
The red splotching where
Okay.
where it looks like there's some blood coming to the surface of the skin.
Okay.
It's called TKI.
So it's not a bruise like what cupping would leave,
Right.
but just short of that, I guess.
Just short of it.
Okay.
Because the idea is not to create that much damage.
And is this, would you consider this better or just different than
It's
like
different.
using your own hand?
It's different, yes. So
Okay.
it's sharper and it creates more localized tissue focus.
Okay.
So basically it does a little more damage, but like I said, it increases that inflammation aspect
Yeah.
to help promote the healing.
And you're using that if you feel like you need to just get a little bit more
Right.
out of a particular area. Is that
Correct.
Is that
Yeah.
right?
So like,
Oh, I'm sorry. Something I was going to ask. Is
ahead.
cupping pretty damaging to
No.
the muscle?
not necessarily.
Okay, gotcha.
Now, you can start feeling sick or really sore or painful after cupping if it's too aggressive. I have a pretty nasty cupping scar on my shoulder right now.
Yeah.
And the day after, I was not happy.
Like pain or?
Oh yeah, my whole left side was in pain.
Wow.
Gee.
But that's also because I've been having issues with that side already. I'd been dealing with a back injury, which I thought was a sternum injury,
Okay.
but it's also related with my original back injury because the nerve would actually wrap around my rib cage when I originally injured it.
Yeah, I've there's a lot of this a really good friend of mine. He calls it the victim and the culprit. Like just because you feel an issue in one place doesn't mean that necessarily is the place of the problem.
Exactly.
And that actually leads me to another question that I wanted to ask you. When it comes to an injury specifically, and sometimes when you massage an area that is injured, you get that good hurt feeling. I've also heard other people say, though, that when you have that, it's more important to like massage around the area and you should avoid massaging on the injury directly. What are your thoughts on that?
No, 100%.
Okay.
So you do want to make sure you focus on the areas around the injury too.
Okay.
Because after an injury, obviously that tissue is going to be hard, right? But then also the tissues around it are going to take more slack up from that because you're trying to protect it. You're trying to compensate. It's called compensation.
Sure.
And so that'll cause other tissues like that to just hold more tension automatically.
Yeah. So you're doing that in addition to, so you're doing the injury itself and around it?
Correct.
So you should not avoid the injury.
Not necessarily. It depends on the severity of the injury.
Okay.
Now, obviously, if it's like a bicep tear or a pectoral tear.
Like an actual tear.
Yeah.
Right.
Prob-
And we're not
probably
getting into
don't-
specifics right here.
Yeah.
Right
Probably
now, but-
probably don't do that. Probably
Right.
don't work directly on the pectoral tear.
Right.
Because you're more likely to cause more injury if it's too close to the specific injury time. For example, I'll go for this as an example. I worked on a client last Saturday.
Okay.
She had broken her, what's the word? Not distal, proximal tibia.
Okay.
So the shin, top of the shin, shattered it.
Sounds terrible.
Yeah. So she was 3 weeks out of her treatment. Okay. So she wasn't completely walking on it yet. So I avoided working directly on the knee.
Right.
Directly on the knee, directly on the shin. We didn't do that, but we did work the calf a little bit.
Okay.
We worked a little bit the tibialis. We worked her leg, her quads. And the idea for that one was more of a relaxation effect. That's Swedish, like I was saying before. And there's also the effect of lymphatic drainage, which is another form of massage therapy that some people practice.
Yeah, I've heard of that. Can you, maybe without getting too far off track, I have heard of that. No clue what it means, though.
Yeah, so lymphatic drainage, basically you're trying to facilitate the lymphatic movement in that area. So swelling, sometimes the swelling is because of water retention or lymph retention because of an injury, right? Because I can't quite move it properly. And so they use lymphatic drainage a lot in medical, for example, like with cancer, any type of injuries as well, any type of bone breaks, etc. Because they'll have that swelling. You want to mobilize that swelling, that liquid that fat. That
Are there
lymph.
are there benefits to that style of massage
Oh,
even
100%.
outside of these situations?
Oh, 100%. Yeah.
Yeah.
So I know another therapist, and she does lymphatic drainage, but she does it for the face. And she'll actually get results visible results of reducing water retention in the face.
Interesting.
Mm-hmm.
And this water retention is being caused for multiple reasons, I'm
Multiple
sure.
reasons. Yeah. Diet, or lifestyle, lack of movement, whatever. Right.
Mhm.
Or maybe it's just, they have an issue. Maybe they used to have cancer.
Mhm.
Maybe they had chemo and radiation. They don't have that lymph anymore.
Mhm.
Because I have another client, and he had cancer, and he basically has all of his muscles in his front of his neck. His lymph nodes are destroyed. A lot of damage, but he's still getting after it. He works hard,
Okay.
and he works out in the gym too.
So he has to come see you though to get that proper drainage because
Not just me, but
Okay.
he does a lot of things.
Okay, gotcha.
But he does need me. He's quite attached.
Oh, really? Yeah.
Yeah.
Yeah. How often do most of your clients? I mean, once a week, once a month.
It depends on the client.
Okay.
So a lot of people like to see me once a week if it's at the gym, for example.
Mhm.
I'll just do like 10 to 30 minutes depending on what they want,
Okay.
depending on what their issue is, what their time constraint is. A lot of people there work very busy work schedule. you know?
Sure. Yeah.
So, once a week for 10 or 20 minutes isn't bad,
Right.
But if it's like a whole hour session every 3 weeks to a month or so would be what I usually like to do for my clients.
Yeah, it's kind of like your recommendation.
Yeah.
And for those shorter sessions, usually focused on a particular area.
Correct.
Right. For whether it's an injury or just like a discomfort. Like for me, for example, it seems my whole right side of my body seems to be a problem.
I see that a lot.
So it's like it's always something. Like even if it's a minor thing. And another thing, a really good friend of mine, his name is Frank, Dr. Frank at Rebel Mobility and Fitness is the name of his business. He calls it his like priority list. He's like, everyone has like one or two things you should probably always be working on.
Right.
Right. And now every once in a while you might have something that takes priority over that. But if
Correct.
you have nothing major going on, you kind of always feel like, and so for me, that's going to be like the right hip, my right shoulder.
Right.
I'm kind of like always working on those things.
So I'll ask you this. When did you start having those issues? Because usually there's an old injury that tends to stem it from.
Yeah. So what happened there, and actually Frank is the person that kind of helped me figure this out. I was playing slow pitch softball probably, man, this has got to be 10 or 11 years ago now.
Okay.
'Cause I'm 33. I was probably like 22, 23, something like that. And I just destroyed my right hamstring.
Okay.
Now this was, I was young.
When you say destroyed.
Like, I mean, it was blue, purple, and green.
So you
for a
partially
month.
tore it at least.
Yeah, at minimum.
At minimum.
And then that bruise, and I never did anything about it other than just like rest. At that time, I was young. When you're young, you're 22 and you're
partial tears
know.
don't require surgery usually. But
yeah, and it didn't. I mean, I healed, but I don't think that it healed correctly.
Right.
And I think is a big reason I have
Probably
a
some
lot.
scar tissue.
Yeah, he said that the fascia likely didn't heal
Right.
like aligned, just right.
It
So
can do that. Yeah.
I'm always kind of dealing with those things. So
what do you feel when you move it?
So in general, I feel fine most of the time. But like, for example, if I get on a foam roller or if you were to like
Start working on it.
Start working on the right versus left, there would be a major difference probably between the right. So it's just like a constant battle. Do you ever see situations like that
Oh, 100%.
eventually do like relieve over time?
Oh, you mean as in like in your situation that
Yes.
it relieves over time?
Yeah, just making it as an example.
No, typically, if it's already progressed to that point, it's not just going to get better over time.
Right. So
You need some manual therapy. You
Right.
need exercise. You need proper nutrition.
Oh, okay. Tell me about that. What do you mean by proper nutrition to heal my a muscle issue? Like, why does that matter?
So obviously, I mean, nutrition's pretty important. what is it? They say the CDC or what was it? The FDA?
Yep, probably.
They suggest 50 grams of protein per day, right?
Oh, yeah. Yeah.
That's way too low.
Sure.
The proteins are the building blocks of the body.
Mm-hmm.
You need proteins for everything, you know?
Yep.
They're the reason why, you can actually walk.
Yeah, yeah. And so you're saying that if I don't get enough, if someone, myself or anyone, doesn't get enough protein, this muscle
Atrophy the muscle.
Uh-huh.
You won't have the amount of amino acids in order to actually heal.
Mm-hmm.
So your healing ability will be reduced.
Yeah.
Additionally, if you're not getting the right fats as well, that's also amino acids, fats. I forget what else is in fats, but I'm sure oils, whatever else.
Sure. Yeah.
But if you're only eating inflammatory foods, it's just going to make it worse too.
That's right. Yeah.
You got to eat whole, clean foods.
Mm-hmm. And I definitely do a pretty good job of that part. I found it interesting that to make the connection, but I think it's important to always wrap back around to making that connection of like what you put in your body is what you get out of it.
You are what you eat.
So that's really important. Talk to me about, modifications of training with injuries. So let's say someone's coming to you and, they have an issue. Y'all are working on it.
They're not able to do the things they used to.
That's right. So how do you make a determination on what they can or can't do, or how can someone listening to this, make a determination?
I personally can't make that determination.
Okay.
Because that's outside of my scope of practice.
Okay.
If that makes sense.
Yeah,
I'm not a
sure.
trainer. I'm not a chiropractor. I'm not a doctor. But what I say is listen to your body.
Okay.
And that's the biggest thing that I think people can take away from massage therapy is being able to listen to and treat your body properly.
Mm-hmm.
Not abuse it, not, neglect it. Make sure you give it the rest. Make sure you give it the stimulus it needs.
Mm-hmm.
That means exercise, the rest, hot bath, cold plunge, whatever you want to do, whatever your preferred method is. But the biggest thing is you have to feel where your pain level is, whether you can tell if that's doing more damage or not. You have to listen to your body.
Yeah, I'm glad you said that, actually. I'm not a physical therapist,
Right.
and I don't try to pretend to be, but I have a lot of friends that are, and I do seek them out for advice and things like that as needed. And I always, no matter what, however complicated we want to make this subject and matter, it seems to be you can always fall back to this simple rule, which is if something hurts, don't do it. If it feels good, you're probably okay to do it.
I'd say a certain amount of pain or discomfort is acceptable.
Sure, yeah, and I let me define the difference of discomfort and pain.
You know what I meant.
Yeah, and that's a great point, though. Like, there is some nuance here, and there is always nuance when we're talking about these things. But there is discomfort, okay. Pain, no way.
Right.
You
so
know?
It's about that level.
That's right. And if I say
it depends on what type of pain.
Yes,
it is
and
too.
you mentioned earlier that like a 6 was a good. When you're getting a massage
for therapeutic purposes.
For therapeutic purposes, about a 6. I always say like in exercise, it should be about like if it's more than a 4, I would consider that pain.
Right.
If it's less, then we could maybe consider it a discomfort.
Right.
And discomfort we can work through, and maybe we can modify a little bit, change things just a touch, like maybe change an angle, right? Change the load, like the amount you usually bench press with 225. All right, well, we're going to use 165.
Yeah.
Right. Just as an example, you can change a little something to get it out of a 6 and down to a 3.
Right.
And then we can work around that discomfort, and that's probably okay.
Exactly.
And another rule that I use, I'd like to hear your thoughts on this one. This is one that I made up myself,
Okay.
But that rule when it comes to pain is if movement helps, keep moving.
Exactly.
If movement hurts, we need to go somewhere and get either imaging or get it checked out by a professional, someone that's certified to check this actual
That's not
injury.
a bad rule to have.
Yeah.
Unless, you have more understanding yourself.
That's fair. Yeah. Do you have any maybe examples of that?
Yeah. So I hurt both my legs last year, different times.
Okay.
First one, I fell down the stairs. It was 12:30 a.m.
I got to hear the story.
and
Yeah,
the alarm
please.
was blaring because we have a faulty sensor in one of our windows.
Okay.
So I set the alarm at night because my dad wasn't around.
Mhm.
They'd gone on a trip. So I was the only one in the house. I get a phone call. I don't wake up at first. And then I finally wake up and I'm like, I look at my phone. What? I hear the sound, the alarm blaring. And I'm like, oh, God dang it. So I fly down the stairs. I trip, fall halfway down the stairs with my leg laying under me. And immediately I knew,
Yeah.
I messed that up.
Mm-hmm.
And so I turn the alarm off. I go back upstairs, try to get back to sleep. I probably don't get back to sleep for an hour because I'm literally just
pain.
hurting.
Yeah. What was the injury? Did you ever like figure out what actually happened? Like what the injury was?
Initially, it felt like it was my big toe. That was the biggest complaint at first, right? But then over time, I started feeling my peroneal.
Which is what?
The peroneal is a tendon, ligament, muscle, etc. It goes from the top of your foot or inside of your foot, kind of right here.
Okay.
Kind of wraps over the top a little bit, and then it goes all the way up the knee.
Okay.
And it was just on the lateral side, so the outside.
Okay.
And it took me probably good 3 months to heal it.
And what'd you do about that? Talk to us about the process.
So first, you got to make sure you move it. So I continued to walk how I could, right? So I was up on my toe. I was literally on my balls of my toes, just like a freaking ballerina.
So your foot extended felt better.
Yes.
Okay.
Because I wasn't putting all that extra stretch on the damaged tissue.
Ah, I understand. Okay.
It's about manipulating the load.
Uh-huh. Gotcha.
So I did that for probably a good month.
Mm-hmm.
Eventually, I was able to start extending it again. Or I'm sorry, not extending, flexing.
Yep.
Yep. I was able to start flexing it again, and then that still hurt.
Uh-huh.
So then I started using flossing bands. Are you familiar with flossing bands?
I don't think so.
So you wrap them around the joint. It compresses, pushes some of the blood out, adds some stability. And so I would walk on it with the flossing band on.
So it's just like a rubber, like I'm imagining a rubber band that you just put around your ankle.
They're kind of thick.
Okay.
They're like a resistance band.
Yeah, I was gonna
But
say, it
smaller.
sounds like a small
And
resistance band.
it's
for your
not a
foot.
resistance band because it's not a complete band. So it's like a strip.
Okay.
But it's rolled up in a ball. So you wrap it, and then you tuck it under. So you could also do reps with it,
Okay.
just
To
mobilization.
like add resistance.
Not so much resistance, but stabilization.
Okay.
Compression, stabilization.
Is it like a KT tape?
No,
Okay.
not quite. It does some of the same things as KT tape, but KT tape is more, it's more about helping pull the tissue rather
Yes.
than compress and add stability.
I'll have to look this up. Yeah, I'm not
Yeah.
familiar, but I mean, I'm picturing what you're talking about now.
Right.
But,
So basically, it just compressed the entire ankle because I'd wrap it.
Okay.
Kind of like how you see boxers do the
hand
the
wrap?
fist wraps.
yes, like between each finger.
Correct.
Right, to be
More
stable.
stability.
Yeah. Mhm.
Exactly.
Okay.
So same type of idea there with the added effect of you're compressing more.
Okay. And so you said 3 months of that, just slowly but surely. Did you?
I continued progressing my movement
Okay.
as long as, it wasn't too painful. So
So just a little more, a little more, a little more, until
more.
eventually.
I'm back to normal.
Yeah. How do you build that kind of patience? Because, dude, injuries suck.
I did it because like I said, I injured my back in 21.
Uh-huh.
And the first thing I started doing, I started trying to get a little more massage. Most people couldn't really get to the spot, which is what I found. But the biggest thing I ended up doing is I started exercising. So I started rucking. Are you familiar with rucking?
Yes.
So I started working out with this group called F3.
Sean, do you know them? Sean likes to ruck.
I don't know them. No, I do
But,
go rucking with a little group.
They're a
but-
free men's workout group. They meet up at like way early in the morning.
Yeah. Sounds like my kind of guys.
Yeah,
like
they're pretty cool guys.
Yeah.
So they'd meet up out in the morning, different parks or whatever, and they encourage you to come out more.
Sure. Like to get
It's a
active
community,
and, it kind of gets you active, accountability.
exactly.
Right. Yeah.
And so every Friday they do Red Ruck Friday.
Okay.
And so we ruck 5 miles for about an hour or so.
Very cool. So you worked your way into that though.
Correct. And obviously that rucking, it was not comfortable.
Uh-huh.
It wasn't comfortable, but I wanted my back to get better. And a lot of people misunderstand the idea of disc injuries, herniations, which is probably, I've never had imaging done, so, but you have to exercise.
Yes.
You have to give those tissues stimulus. Same with any other tissue.
Mm-hmm.
But the problem is so many people are so afraid.
Yes. We get a lot of that here when it comes to the disc issues. And
People,
don't
go ahead.
Well, I was just say, don't quote me on this, but I want to say that some 55 or 60% of men over 40
have some herniation.
Yes.
That doesn't mean that it's a full causing pain even.
Right.
I've read about this too.
And the recommendation from the smartest people are to keep doing things, not avoid things. So that's like a mental thing. Do you ever?
It is.
So you see people with injuries. Here's a question: someone comes to you for an injury. Do you have a hard time getting them to do things because they're afraid of re-injury?
It depends.
Yeah.
It really depends on the type of client they are. If they want to get back to where they are, but if they're gripped by that fear of that pain, you have to let them know, pain, it's not great.
Right.
But it's a sign, it's only a signal.
Right.
It's telling you that something's wrong with the tissue.
Mm-hmm.
And with that signal, with that information, you have to take it and be like, okay, this sucks. What do I have to do to make the change? What do I have to do to make it better?
Mm-hmm.
And that's what I try to tell them. So I know it hurts. I'm sorry that this one's really uncomfortable. This one spot's really uncomfortable.
Yeah.
I want you to take a deep breath.
Mm-hmm.
It'll get better.
Yeah.
And that's one of the other techniques too. It's funny. Maybe you've never, but I work on a lot of people. Sometimes they get ticklish.
Okay. Yeah.
So I'll be working on their quad or their IT band or right in the subscap area, for example, right in the armpit. And they get ticklish.
Yeah.
And what I always tell them, it works 99% of the time. Hey, I know it's ticklish. I'm going to put pressure. I want you to take a deep breath. They take that first deep breath and the ticklish goes away.
Really?
Yeah. It's fun.
Yeah, I'm sure that.
And then they're so surprised at that. And it's just like, what?
Yeah, we kind of skipped over your other leg injury, but I'm now
That's okay.
Now you got me sparked in some interest with this ticklish thing,
Right.
Have you ever been in some awkward situations with a client? Maybe they're ticklish and it just keeps happening. They're like, no, keep trying, and then they just can't do it.
No,
or
usually they don't want you to continue on the ticklish spots.
Okay, yeah.
I'm usually the more persistent one.
Okay.
If it's one of those areas that's just constantly ticklish, and I go over it and then they don't like it, they're usually more, okay, we can move on from that.
Yeah,
They get annoyed. They get frustrated.
Yeah, because they're there to feel better.
Correct. And not be played with.
Yeah. Are there any other, in massage therapy, there is some stigma, that I've heard. So I kind of wanted to ask you a couple questions, if you don't mind, around that. Mm-hmm. Is that something you've ever had to deal with?
The stigma?
Yes. The people's perception of massage and what it is.
100%. So, for example, over at Apex, there's a couple gentlemen, older gentlemen, what's the word? Not traditional, more old type. You know what I mean?
Yeah, I know old school.
Old school. That's what I was looking for. Thank you.
Okay.
And so when I was starting to work there, I'd
say,
hey,
type of,
sure,
yeah.
you can say that. You can say that. But I'd say, hey, I'm offering massage therapy over here. If y'all are interested, no, man, if someone's going to be touching me, it's got to be a girl.
Yeah. Don't worry, dude. I'll make you take your pants off.
No, I don't. I do my best to actually avoid jokes like that.
Yeah, in a professional setting, you should not do that.
Yeah.
But
no, and it's funny because a lot of the guys at the gym, the other workers, they joke with me. They give me hell.
So you never had an actual hard time with anything like this?
A hard time with no, not particularly. Most clients are pretty cool.
Right. Yeah.
But at the same time, it's just like, it gets like, oh, okay. You can't take it personally.
Sure. Yeah. And that's really, I mean, even in, in personal training, it is important sometimes to touch people. So we be very cautious.
Right.
We use, here at our gym, we call it the 2-finger method. So if you have to touch someone, you show them with very clearly, hey, I'm coming in, like, this is my signal that I'm coming to touch you, and you kind of let them know, especially if it's a male to female. And if it's a male to female, we won't touch,
Right.
but we will use the 2-finger method and get like an inch away, and it has that similar effect.
Okay.
So
Interesting.
that's one way that we've kind of worked around that, and has never really seemed to be an issue for us.
Right.
But
that makes sense.
I was curious if you've ever had to, as a male massage therapist, like if there's ever situations like that you've had to deal with, maybe uncomfortable situations or.
Yeah. Well, I mean, no, of course, ladies always are more uncomfortable with men.
Yeah.
Regardless, they view us as a threat.
Sure. Yeah. I mean, it even happens here in the gym. Like a lot of times women want a female personal trainer.
Right.
But
then, of course, it's also that comfort.
Yes, right. And a lot of times what I've noticed is that they may, we have a few different trainers here at our gym, and they might work with the female the first couple times just to get comfortable in the environment.
Right.
And then they'll kind of be,
more comfortable with the rest of them. Because then they're in the environment, they see how you interact, and then they're like, okay.
Right.
They just have to get to know you sometimes too.
Yeah, exactly. And so, like in your case, maybe these guys, if they were to see a female massage therapist a couple times, then maybe they'd be more open. I don't know.
Maybe.
I don't know if they would or not.
They feel like the female touch is more healing.
Yeah. Well, maybe they just like it better.
Yeah, that too.
You never really know. But so Apex, that's a gym, right?
Correct.
It's a gym. So tell us kind of, how do you work over there? Do you have certain hours that you're there? Or,
I do.
How does that work?
So typically I'm there from 4 to 8 p.m.
Okay.
Monday through Thursday. I just operate right next to the front desk.
Okay.
So we don't have you undress or anything. I clean my table after each client, of course.
Sure.
But we still have you stay in your athletic clothes.
Okay.
So I work over the clothes, through the clothes if I have to. If there's an area that requires a little more work, if they want cupping or something, depends.
Sure.
But typically we keep the shirt on. If girls are already in their sports bra or whatever, that's fine. Not a big deal. I'll do a lot of abdomen work for a lot of people, actually.
I could actually see that being very beneficial, because a lot of people are tight in all kinds of areas. And I know for me, for sure.
Psoas, diaphragm, iliacus,
Yeah.
transverse abdominis.
I have a question just popped into my mind talking about being at the gym. If I'm going to do massage, even if it's just a 10 or 15 minute session,
Right.
I'd like to ask both actually, if it's 10 or 15 minute session, or even if it's a full hour, like how do you think about working out like in the same day? Or do you recommend
I think it's great.
Before or after?
Both.
Oh, okay. Either so
I can do either way.
Irrelevant. Doesn't matter.
I wouldn't say it doesn't matter.
Okay.
It depends on your goals.
Okay. Tell us about the difference.
So, for example, for some people, I like to get them in before their workout.
Okay.
Especially if they're already having issues. Because for one, I can increase, like I said, reduce the inflammation. I can help increase that mobility. But at the same time, it also helps increase that mind-muscle connection in that area. Because they have more mobility.
Yeah.
The fascia's loosened up, right? So now they can access that area more.
It's a great point.
And then they also have more control.
Yeah, because something that we talk a lot about for us as personal trainers is we talk about proper range of motion.
Right.
So if someone has a bunch of inflammation, their mobility is lacking, you can open up the mobility,
Correct.
allowing for better range of motion and a more effective workout.
Right. And sometimes those mobility issues are from old injuries. Maybe you lifted wrong. Maybe you tweaked something. And a lot of it is just mobility restrictions due to that tension.
Yeah. And what about but the massage after a workout, I feel like
It can be more therapeutic for recovery.
That's what I was thinking in my mind, and you can correct me if I'm wrong, but I'm thinking of after a workout, I can use it as more of a recovery situation.
Correct.
Like I just hit my muscles really hard.
For a lot of people, they'll end up having more trigger points right after their workout. And so I'll kind of get to those areas they worked on. I'll work on the areas around it. So like if they're complaining of some neck and trap issues, right?
Yeah.
One of the issues I always try to work on the chest.
Okay.
If they're having issues with their neck and the traps. Because the they're antagonistic muscles.
Sure.
So, chest pulls your chest forward, traps and neck pull your back, right?
Mm-hmm.
They fight against each other. And so if you relax them both, then, all the better.
Yeah, then you're opening up proper posture, proper range of motion during
Correct.
your exercise, allowing you to get in these different positions and make your the exercise that you're doing more effective.
Correct.
Because you're the longer your range of motion, the more lengthening of the muscle fibers. All these things are benefits.
Exactly. And
right?
especially in our modern world, we sit,
Mm-hmm.
we hunch over on our phones, we work at computers
Mm-hmm.
long periods of time.
Sure.
We get stuck in these positions for extended periods of times. We get tight.
Yeah. So a combination of massage, cupping, scraping. Are there other modalities that you use yourself?
Overall, not at the moment. Sometimes I'll use heat when I work at this other chiropractor I work at.
Okay.
So like they have hydro packs.
Mm.
No, what's not the word? It's
a
I don't
heating
remember.
pad.
It's a
basically.
heating pad. Yeah.
Okay.
They sit in the water. Elements heat the water, heats the packs. Wrap it in a cover, put it on their back.
Yeah.
Move it
needed.
around.
Mhm.
Yeah. Move it around so it doesn't burn them.
Okay.
Because
cool.
it does get really hot.
Yeah. I mean, that's the advantage of using this special type of pack. Is it probably
Right.
gets extra hot and stays hot longer. Maybe
Exactly.
something like that.
It imparts more heat into the tissue.
Sure. Okay. Cool.
And that same thing, heat increases the blood flow.
Mm-hmm. And if someone wanted to work with you, whether it was direct massage, whether it's like a 10 or 15 minute
Mm-hmm.
setting with, over the clothes, or is more of a full hour session where
Mm-hmm.
you're working on a particular situation or injury, what's the best way for someone to do that and get a hold of you?
So I have an Instagram. It's andrew.d.lmt.
Okay.
Andrew Deering, licensed massage therapist.
Okay.
Pretty simple.
Mm-hmm.
That's my Instagram. My personal phone number, I have it on my cards. And then I also have an email,
Okay.
which is, again, andrew.d.lmt@gmail.com.
And Apex, you're there from 4 to 8 p.m. That's
Correct.
Monday through Friday or
Monday through Thursday.
Monday through Thursday at Apex. And that's in LaPorte?
LaPorte, exactly.
Okay.
Off of Spencer.
Yeah, I've never been there, but I know Sean
Dude,
likes to go to Apex.
Apex is cool. Yeah,
I
it's a
love
really
the
cool gym.
aesthetic.
Yeah,
I've never
That's
been
the
over
big
there.
thing they
they push over there.
that's what they push. They
Okay.
Yeah,
it's
cool.
It's the vibe.
Yeah, it's cool because it's like 3 gyms in one. So they have like one that's like more
With more coming.
commercially. Yeah, with more
It's getting
coming
bigger?
apparently.
It's getting bigger.
How big is it? Do you know how many square feet it is?
Not at the moment. I don't know off the top of my head.
A
But
lot.
I do know
It's like a
that
old
we're going to add
supermarket.
10,000 square feet.
You're going to add 10,000.
Yeah, they have the 2 next door buildings
Uh-huh.
bought. They're actually currently building it out right now. It's going to be a
Wow.
powerlifting space.
Okay. Cool.
Nice.
So right now, you said it's 3 gyms in one?
Kind of. So they have
So
like
there's the primary gym where you have most of your machines,
Okay.
your cardio machines, and then all of your assisted machines like the leg extension, all your cables, etc. Right? And then in the second gym is where most of the plate loaded machines are. And that's where more of the barbells and everything else is.
Okay. Gotcha.
Right. And then in the third gym is more the functional gym. You have kettlebells, dumbbells, boxing bags.
Is that where I'm assuming this is where you work out.
It's where I work
Do you
out.
pick
yeah,
like
a lot of the time.
a form of exercise for the day? And so do you have like a strength day and then a
I
functional
usually
day?
have more of. I usually do a split,
Okay.
but I haven't been training as much because of this injury.
Yeah, I can overcome. You doing some like self stuff, or do you have someone that you see?
I do have someone I see.
Okay.
We trade occasionally.
Uh-huh.
We trade twice now,
Okay.
but I've gone through a lot of different other therapists
Okay.
because it's hard to find a therapist who works on you the way you want to.
Sure.
And so I actually see this guy. His name is Matthias.
Okay. Cool. Yeah, man. If you make us a connection, we'd love to talk to him maybe about what the specialties that he has and stuff like that as well.
He does a lot too. He does some cupping. He does that other stuff, but he also does some active. I do active stuff too.
Okay.
Active releases
Mhm.
or passive releases. There's different types of techniques, obviously.
Okay. Yeah. Very cool.
But Matthias is really cool. He's very knowledgeable too. He does a lot of calisthenics actually,
Oh, interesting.
like planches and levers,
I'm not sure what a planche is.
like gymnastic stuff.
Yeah. I've considered trying some of that, but
Mm-hmm.
I don't know, man. It just never goes my way, I guess. Maybe Maybe my functionality is just not quite there, but probably just take some practice. I'm sure you have to be
is
dedicated to
practice.
those
25,
things.
2025 goals, man.
Yeah.
Calisthenics.
You really got to be dedicated to calisthenics, dude.
Amen. That's
You-
life.
so
dude.
he
tough.
literally spends the entire morning like doing all of his different positions.
Wow.
Like it's crazy. He posts it on his story all the time.
Okay.
I'd have to pull up his
Yeah, I'll have to check
to
it out.
see his Instagram.
Yeah, very cool. Well, do we miss anything? Is there anything you want to cover? Sean, do you have anything that you wanted to cover? A question?
Yeah, I did have 2 questions.
What's up?
Let's see. So one of them was how important is sleep as far as recovery and your movement and your effect on your like fascia and inflammation and things like that. Like,
Highly
question.
important.
yeah,
highly important.
Yeah, yeah.
You need to
that's
get
kinda
your
what I was
sleep.
thinking.
Period.
Scale of 1 to 10, 10 being the most
10.
important. Okay.
Yeah. I'm a 6-hour guy. Is that not enough?
It depends on you. There are people.
6 hours feels good to me.
There are people who have a genetic. I've read about it, anyways. I don't know firsthand, but genetic disposition towards it. They only need 6 or 4 hours of sleep a night.
I've read similar.
Yeah.
Okay. I didn't know that. Yeah.
It's a thing.
Yeah, some people actually need 9, and then some other people
And
need
actually
only
women
6, right?
Women actually need more
Yeah,
sleep. than
women
men.
do seem to need more. Their
No,
genetic,
They do.
yeah,
Period.
okay, yeah.
No,
their
okay.
genetic need is higher
Gotcha.
than men's, for sleep. Sure.
Okay. Yeah. Well, yeah, I didn't know that at all. And so I guess the second question is, I know you said you do administer some homework. How do you feel about Epsom salt and Epsom salt baths? And do you
I've
think
never used it myself.
you never use it yourself?
No.
Okay.
But
do you think it's like a
good option.
placebo?
I don't think it's placebo.
You think that the actual salt in the bath is helping with muscle recovery?
I'm honestly not too familiar with it. I couldn't give an opinion on it.
Okay,
But I don't
gotcha.
think it's just placebo because it's so widely used.
Yeah. No, I use it a lot too. I was just wondering your opinion. I love Epsom salt baths. So yeah.
I don't have a informed opinion. So if I don't have a personal like informed opinion on something, I usually try not to.
Understand.
Best bet.
Yeah.
Because even cupping, before this Sunday, I had never had cupping done.
Interesting.
And now that I've had it done, like, okay,
I can speak on this.
I can speak on this now.
Yeah, very cool, man. Well, I appreciate that. That is a very respectable thing for you to do because, a lot of people just like to, spit information about nothing that they know.
Right.
So that's never.
I've
that's
never done
a good
cold
thing.
plunge, but I've read all the information, I know all the benefits,
Right.
So I'll tell the client, hey, cold plunge, it'd be great for before you work out, but it can be harmful if after your workout, depending on your goals.
Depending on goals, right?
Exactly.
Yeah, for sure. Okay, cool. Well, dude, I appreciate your time.
Of course.
Thank you so much for coming on.
Thank you so much for having me.
Guys, if you need massage done, hit him up. He's at Apex every day, Monday through Thursday from 4 to 8.
Correct.
And then also flexible outside of that.
Correct. So I try to sometimes I'll do some in the morning before I go in.
Okay.
So like usually latest I'll do like 1 or 2 p.m. appointment. That way I can still be at Apex.
Sure. Yep.
And then on Fridays and Saturdays, I'll usually be available in the evenings. But as far as Sundays, I'm fairly open usually, depending on if I have anybody scheduled.
Awesome, dude. Appreciate your time.
Of course.
Guys, thank you so much for listening. Make sure you like, subscribe, and we'll see you next time.
Thank y'all.